New South Wales government has launched its latest campaign to crack down on vaping addiction in young people. It comes as a new survey reveals a 16.5% increase in vaping in those aged between 16 and 24.
I woke up like gasping for air and just rushed me to hospital.
My lungs just felt like they were on fire.
And I'm coughing black stuff into a tissue.
For me to all of a sudden have lung pain in my 20s, I really did think I was going to die.
Joining me live now is the New South Wales Health Minister, Ryan Park. Ryan, thanks so much for your time. Do you think this could be as serious as, another looming health crisis that we don't fully understand right now?
Well, I think this is the biggest public health challenge our community and certainly our young people face. It took us around 3/4 of a century to try and reduce smoking rates down in this country and in this state. We simply cannot afford for this to take that long, and we've seen a tripling of the number of young people who are taking up vaping. And I've got to do what I can, schools have got to do what they can, and families and parents have got to do what they can to address this issue for our young people.
The science doesn't seem to be keeping up with the public health message because there has been such an explosion in vaping, Minister. I guess we don't know what the consequences are at this point. Is that the main message here? That you're going on this anecdotal evidence from these people who really almost died because they were vaping so much?
And what we're trying to explain to young people is that the very short-term effects we already know about difficulty with breathing, respiratory issues, problems with their lungs, poisoning. These are issues that we know can happen fairly quickly, on top of, obviously, one of the worst things that can happen, which is nicotine addiction. What we don't know yet, given that vaping hasn't been around for that long, is obviously the potential medium to long-term problems. And what we're saying to young people is, please don't get addicted to nicotine, because we already know the damage that that drug can do, and we saw some real challenges over the last century bringing smoking rates down. We can't wait that long to bring the rates down of people vaping. It will just lead to too much harm, especially amongst our young people.
Minister, one ad campaign, you and I both know, is not going to do anything to bring the smoking rates down. Yes, I'm not saying it's not going to have an impact at all. Mark Butler is about to announce essentially that Australian Border Force has seized a big shipment of vapes coming into the country. But both of these things don't really touch the sides, do they? What else needs to be done? And I'm not saying New South Wales can do it alone, by the way.
Well, what we need to be doing is exactly what you're saying, which is work together both across government, and that is a big issue for the federal government to try and reduce and stop that supply, because we know, Laura, at the moment there's simply too many vapes in our country. We, as the state government, have got a role to play in enforcement around retailers, running ad campaigns and providing education amongst our school students. But parents and families have an important role to play as well, and that means, like I have, like many of my friends have had, having those challenging conversations with their young children.
Just on retailers, do you understand how easy they are to buy? Do you at a state level and at a federal level, ministers, realise just how easy they are? They seem to be available on every street corner in convenience stores, and I imagine you can buy them online too.
Yeah, well, that's why we are cracking down on both the supply and from March we'll be cracking down further and tightening the regulations to make sure that these products are only available.
What's cracking down mean? Like
that means
a
that
police... Yeah, so have there been any fines issued? And what will you be doing from March to bolster that?
So firstly, we've seized over 380,000 vapes through retail outlets in the first 9 months of last year. That is doubling the amount we seized in the previous 2 years. We have dramatically increased the number of enforcement staff that are going out there through New South Wales Health, right across New South Wales, cracking down on retailers doing the wrong thing. And from March, these vapes will and should only be available through a proper cessation program for smoking and through a prescription model through our pharmacies. Now, we're not saying that all of this will dramatically or all of a sudden reduce the number of people who are vaping. What we are saying is that we as governments at both the state and federal level have to do our bit, but so too do schools, teachers and families do their role as well.
Haven't we learned from the smoking issue, haven't we learned what works? What seemed to work there is that, tobacco was a legal product, it was, majorly taxed, and the plain packaging made it less sexy to young people, so they didn't take it up. The cost and the plain packaging was the thing that stopped young people from taking up. Why can't we do that with vapes?
Well, because we believe going down a prescription-only model and trying to cease and reduce the availability of vapes within the country and within New South Wales through retail outlets is the focus. We've got to remember
Minister,
that
can you tell me
smoking
this
essentially
then?
got away from us.
I think there has been, as you say, large amounts of seizures through retail stores, and that seems to be mildly successful. But in percentage terms, how much does that make up of the vapes that have been available on the market? It's still very low, isn't it?
Well, I don't have that percentage available, but
would it be around 10%?
I, for one, have made... Well, I'm not 100% sure what the overall percentage is. What I do know is that we're increasing the seizures and we're increasing the enforcement, but I'm also very aware that unfortunately in New South Wales and in Australia, the supply of these products has got ahead of us, and what we need to do as governments is do our role to try and reduce the availability of these products to our young people.
Well, those ads will go some way to work. They're quite terrifying. If you vape, one of those young men was about half an hour from dying and losing so much oxygen. Minister, thanks so much for your time. Appreciate it.
Thanks a lot for having me.